Hey everybody, it's Dan with Pain For You. Today's topic: surgery or medical treatments I didn't need. And I'll get to that in a second. Let's take a couple of breaths, turn around and let you take a look at the nice blue sky. Breathe in the confidence, breathe out the doubt, breathe in the peace, breathe out the noise and the static. Breathe in the knowledge, breathe out the uncertainty. So, hear from a lot of people who say, you know, I had this surgery or that surgery and I've been through 3 surgeries and they didn't work and now I'm worse off for it and that's why I'm stuck. Or they come to the conclusion that the surgery was botched, or the medical treatment was botched, or the medicine has messed them up, or whatever else they have come to believe as a result of failed medical treatments. Over and over and over again, the doctors fail to fix us. As a result, it's very easy to believe that we are permanently damaged, whether it be neurologically, whether it be chemically from medicine, or all sorts of things. Medical treatments we did not need, because now we know about TMS and we go, oh my God, I wish I had known about this sooner. I wouldn't have gotten all that stuff done and I would be fine. But they screwed me up, they damaged me, they permanently injured me, they permanently damaged me. And so, are there exceptions to what I'm about to say? For sure. But the vast majority of cases, it's the belief that they screwed us up that will keep us stuck. It's the belief that we have permanent damage, which is going to convince our brain not to let go of these symptoms. The brain's going to listen to you. And if you've been telling yourself that they botched the surgery and we've got permanent neurological damage that will never ever go away, you're literally putting a voodoo hex or a voodoo curse on yourself to say, I'm screwed, nothing's going to work. And so I will tell you this: regardless of the outcome of the surgery, I believe the body heals. I believe the body is not intended to hurt all day, every day. And if you look at an animal, for the most part, if they get injured, when the body heals, they're done. They don't have lifelong pain because they can't get nervous, fearful, anxious about it, because they don't have the conscious thinking brain that we do. We've got this wonderful thing called a memory and a wonderful thing called an imagination. And this memory of how traumatic the surgery was, and this imagination of, oh my God, what if they screwed me up permanently? My life's going to be messed up forever. Those are things kind of unique to humans. And so I will tell you that if you are repeating a story to yourself, to your doctors, to your family, about how the surgery screwed you up and left you with permanent damage, you're not doing yourself any favors. And look, even if there is something that you can look at on an MRI and go, yep, that's as a result of the surgery, how do you know it's not just learned pain, which is essentially TMS, neuroplastic pain? It's pain that your brain has memorized and continues to send based on the instructions that we've been giving it, which is, they botched the surgery and I'm screwed. And so all I can tell you is this: even with real injuries, we can teach ourselves to keep the pain going. But I absolutely believe that the body heals. We can have all sorts of abnormalities, structural defects, muscle imbalances, right? My body is not a perfectly straight thing. I still am a little bit off kilter, but I don't hurt, and I don't need to hurt. So please don't convince yourself that these doctors really mess you up permanently, because I don't believe that's the case. I believe we can teach the brain through repetition, which was what I just talked about recently, that we are okay and that we are safe. And when the brain perceives that there's no danger physically, it's going to start loosening up and letting go of these pain signals. And so I absolutely believe we have so much more control over the outcome in our nervous system than anybody's ever given us credit for. So what do you guys think? Does this stuff make sense? Are you hanging on to an old injury? Oh, a football injury from, 35 years ago still hurts me. Okay? Or are you holding on to an old surgery as a reason why you can't get better? Is that going to help you out? Or is that the nocebo effect, which means I believe my knee is permanently jacked up, so therefore I'll always have a permanently jacked up knee? Very likely. I know a lady who believes she had botched knee surgery, but yet she can go ride a bicycle for 60 miles, 20 miles of it is uphill with no pain. If the knee surgery was botched, that wouldn't be possible. But yet when she gets home, she's got pain all day, every day. That's TMS. That's classic TMS, right? There's no reason she would not hurt while riding a bicycle, but would hurt while sitting on the couch, right? So, please let go. Stop clinging to this belief that you're broken by the doctor. Let it go. It's not helping you. Even if the doctor did screw up, telling yourself 85 times a day that they screwed you up and permanently damaged you, it's not going to allow you to get better. Convincing your brain that you're actually fine might actually start creating some miracle of neuroscience that teaches the brain not to send the pain, even though there might be a slight defect there caused by a surgery from 5 years ago. My belief is any pain that lasts longer than the normal healing time frame is neuroplastic learned pain, aka TMS, through fear, focus, and anxiety about the surgery not healing. It's all the same stuff, guys and gals. Let go of the belief that you're broken. Because I believe when you decide that you're actually okay and that your body is capable of letting go of these pain signals, you're that much more likely to do that. So I hope this made sense. Not sure if I really did this justice or not, but please, if you're holding on to this permanent damage belief from medications, surgery, injuries, let it go. It's not helping. So, love you guys and gals. We'll see you in the next video. Take care.